Hello and welcome once again aboard JulieCity. As usual, I'm always excited to be here and I'm glad you are here. Thank you so much for clicking to watch today's video. You're highly appreciated. So we continue with our pregnancy care series and today we are looking at placental insufficiency. Placental insufficiency. If this is your first time, I will encourage you to go back and watch these videos popping up on the screen. I'll leave them at the end screen on cards that will be popping up towards the end of this video, so watch right to the end. Better still, you can click on my icon right below this video. It will take you to the main page of my channel, JulieCity. Click on videos and you will see a chronological order of all the videos. Just click to watch to get updated with the previous episodes we've shared on the placenta as an organ in pregnancy. And if you've not subscribed, then hit the subscribe button. Remember to like this video to help promote the video. Leave your comments, leave your experiences. I love to hear from you. Also, when you share your experiences in the comment section, others who will watch later on will also have a thing or two to learn from your experience and input. So, yep, let's get started. As usual, I like to keep medical terminologies as little as possible in my videos. So simply put, placenta insufficiency simply means that the placenta is not working as it should. We've already established in our previous episodes that the placenta plays an invaluable role during pregnancy. Without the placenta, then pregnancy will not thrive. The child will not thrive because the placenta supplies the blood, the oxygen, the nutrients, and so forth and so on that baby needs to survive or thrive in the womb. There are so many things that can make the placenta not effectively work. Some of them are things we've covered in our previous video, but just stay tuned with me as we continue to discuss this. So, placenta insufficiency is a rare condition during pregnancy. However, when it happens, it can be serious. I will stop here to say, if you feel anything unusual during your pregnancy, make sure to speak to your midwife or the doctor looking after you in pregnancy as soon as possible. I always say to the women that I have the privilege of looking after during their pregnancy, that is better safe than sorry. I will also put it out here that a stitch in time saves 9. So whatever is unusual, bleeding, movement problems, whatever you feel your instinct tells you that is not right, is better to speak to a trained professional about it, because again, a stitch in time saves 9. When placenta insufficiency occurs, because baby is not getting the nutrients, the oxygen, and the blood that it requires to thrive and grow effectively, it therefore means that that baby will be small for the age. Maybe you might have heard or read about small for gestational age or intrauterine growth restriction. These are all explaining the fact that the baby is not growing as it should. It's too small for the gestation of pregnancy. I will also stop here to say that please, before you tell a pregnant woman that her tummy is small, beware, because one of the symptoms of placenta insufficiency could be that the abdomen is not measuring as it should. Everyone carries differently. So don't quickly or flippantly remark about how small a woman's tummy is, especially when you are not trained to do so, because that might make her panic or fret. The other thing that might happen with placenta insufficiency is that the movement of the baby might reduce, might be less. So if you're used to feeling baby kicking so frequently and suddenly you realize even after sitting, relaxing, having a little drink of cold water and all that, you still feel over a short period of time that this baby looks like he's very sluggish in his movements in the womb, or the pattern changed completely, that is making you worried. It is important to speak to your midwife or the doctor that is looking after you in pregnancy. Like a lot of medical conditions, with placental insufficiency, The actual cause is unknown. However, there are a few pointers. This might be as a result of malfunction during the implantation of the placenta at the beginning of pregnancy. Now, we have covered a lot of issues around placenta, like I said, and we've done that video, the placenta invasion, or when the placenta infringes during pregnancy. And I will advise you once again to watch that video to the end so we don't make this too long. So basically, if the placenta does not implant effectively at the beginning of the pregnancy, that might cause placenta insufficiency. Also, if there's any damage on the placenta as a result of other facts which I'll be covering, that can also lead to dysfunction or malfunction or insufficiency of the placenta during pregnancy. So other things that could cause placenta insufficiency includes things like diabetes in pregnancy, whether it's chronic or gestational diabetes, preeclampsia or hypertension, especially when it is not controlled effectively, blood clotting problems, autoimmune diseases, kidney disorders or kidney disease, or anemia. These are some of the pre-existing maternal conditions that can impact on placenta, causing the placenta to either be damaged or be insufficient in its function. Also, certain medications, drug misuse, smoking, and some will say even increased maternal age might be a risk factor for placental insufficiency. Remember, our videos are not meant to scare you, rather to keep you informed in order to make the best decision at the right time. Placental insufficiency can be diagnosed through routine antenatal checks, like measuring the abdomen. From 28 weeks, the abdomen is measured and tracked on a specific chart made for you and your baby. And if there's any variation in this chart, the midwife will order for scan. Also, through certain blood tests and obviously ultrasound. That is why it's important to attend your routine antenatal checks religiously. Remember, a stitch in time saves 9. If there's any concern with the blood tests, with the measurement and ultrasound, then you, being well informed, will be able to sit together with your midwife and the obstetrician to make a plan of care that will be most suitable for you and your unborn child. Again, this is not to scare you, rather to keep you empowered so you can make the best decision for you and your unborn baby. Sometimes placental insufficiency might not even be diagnosed during pregnancy and might only be diagnosed after baby is born. Be that as it may, there are risks attached to placental insufficiency. As we have discussed earlier, insufficient blood, insufficient nutrients, insufficient oxygen. What does that now play out to be? Risk to the mother includes preeclampsia or elevated blood pressure, which is important to manage effectively in order to manage placental insufficiency. There is the risk of placental abruption, which we have covered in our previous video. I'll encourage you to watch that to be up to date. Depending on the severity, there might be a chance that the baby might come out preterm, earlier than usual, before 37 weeks gestation. This might be part of the plan which you will be involved with the high-risk team to ensure that the best interest for you and your baby is decided with you at the center of it. No decision can be made without your consent. Risk associated to the baby is greatly determined by how early in pregnancy placenta insufficiency occurs. If it's too early in the pregnancy, then the risks are higher, ranging from low weight, which is obvious, to developmental issues, difficulty in breathing, low levels of oxygen, inability to maintain temperature at birth, inability to feed effectively or gain weight. The risk of infection is higher. Their eyes and vision might be impacted. And most likely, separation, which will prevent golden hour and effective bonding, because if baby is suffering with all of this, the chances are high that the baby will be separated from mom to be looked after effectively on the neonatal care unit, which is not what the original plan is. However, it is needed for survival of the newborn baby. So yeah, that is why it's important that if you notice anything unusual, that you should discuss with your midwife and doctor, so an effective and timely plan of care will be put in place in order to prevent stories that touch. So your individual circumstance or situations will be taken into account when offering care for placental insufficiency. I hope you found this video useful. If you have, then don't forget to like this video, leave your comments. It will really help boost this video and send it to those who will benefit from watching it. If you have not subscribed, then this is the perfect time to hit that subscribe button and the notification bell. That way you don't miss a thing. Share this video. Until I see you next time, don't forget, your health is your wealth. Bye-bye.